It is believed that a heart attack occurs suddenly. However, in half of the patients, warning signs can appear several hours before the onset of the infarction. There is also a group of people who experience warning symptoms even several weeks before it. A heart attack is a life-threatening condition. It occurs as a result of ischemia, when the heart muscle begins to die. The most typical symptom of a myocardial infarction is a sudden and very intense pain in the chest or heart area. It can be accompanied by feelings of anxiety, fear, pallor, disorientation, or an accelerated pulse. However, the symptoms of a heart attack are not always sudden. Sometimes the heart can give warning signs several days or even weeks before. The results of the study were presented at the recent annual conference of the American Cardiology Association in Dallas. They analyzed the medical histories of 567 men aged 35 to 65 years. In 80% of cases, the symptoms of a heart attack appeared from 4 weeks to an hour before the blood supply to the heart muscle was blocked. 56% of patients with symptoms complained of chest pain, while 13% experienced shortness of breath. Let's see what symptoms appear a month before a heart attack. Chest pain. Typical coronary pain is a sensation of pressure or burning, often radiating to the lower jaw. It can also radiate to the shoulders and back. The pain is short, lasting a minute, 2, sometimes 5. It may also not be associated with physical exertion and can occur at rest. Sweating. Increased sweating primarily on the forehead, chest, arms, and legs. It occurs suddenly at various times of the day and night. It is also not related to physical activity or ambient temperature. Men often ignore this symptom, while women may confuse it with hot flashes during menopause. Shortness of breath and fatigue. Feeling short of breath and unable to take a deep breath can be equivalent to chest pain, because not all patients experience them. Not all women experience typical coronary pain. Irregular heart rhythm. The patient notes accelerated or irregular heartbeat. Accelerated heartbeat can also occur in situations where the patient is not nervous. These symptoms can occur with ischemic heart disease. If ischemia occurs several weeks before a heart attack, one of its symptoms may be arrhythmia, abdominal pain. May manifest as a feeling of fullness, rumbling in the stomach, abdominal bloating, nausea, and upset stomach. This symptom is intermittent and recurrent. Sleep disturbances. People with acute ischemic heart disease sleep poorly. They may have trouble falling asleep, waking up in the middle of the night, or very early in the morning. Half of women who have had a heart attack previously experienced sleep problems. These disorders are usually accompanied by anxiety and a sense of devastation. Feelings of anxiety and fear. They usually accompany chest pain. Most people with coronary pain experience feelings of fear. If the pain comes, for example, from the spine, there is no sudden feeling of anxiety. Although this feeling is often accompanied by pain, it can also arise independently. Hair loss. Hair loss, especially on the crown of the head, is one of the lesser-known early symptoms of a heart attack. It occurs in men after the age of 50, but also in women. What to do if you suspect a heart attack? Immediately call for an ambulance and try to stay calm. You don't need extra stress. Get into a comfortable position and start slowly chewing one 300 milligram aspirin tablet. Aspirin helps minimize the risk of developing a dangerous clot. It reduces the stickiness of platelets, minimizing the likelihood of them clumping together and blocking blood vessels.